My name's Anne McIntosh and I'm a senior clinical research scientist at the MBC at Royal Melbourne Hospital. I'm going to tell you about the databasing that we're doing here at the MBC. The MBC has implemented a large research databasing system called NeuroBase, and it incorporates the major research groups here, which are stroke, epilepsy, MS, movement disorders, tumour groups. Each of those groups has approached the databasing in a different way to deal with their own needs. The epilepsy side of NeuroBase is something that's currently developing, and I'm leading that development and implementation along with Smeesha Thomas. And the original implementation was put in place by Kate Birch some time ago. We are developing the database in probably 4 major modules. The overall idea was that we realised pretty early on that, in fact, the clinical treatment work here and the research tended to collect quite similar information. So there was a realisation that they could actually support each other, and that the collection of the research data could feed into supporting the clinical programs. So what we've done and we're working on is meshing the collection of research data by live capture of the data in the clinical programs. So we're setting it up so that the clinicians and the people interacting with the patients can put the data in a live form. That obviously has some challenges. We have to make sure that the data goes in an appropriate form, and we have to make sure that we're not increasing the workload of the clinicians that are using that data. But we can actually assist clinicians and assist the clinical programs by setting up the data input in a way that it reminds the clinicians of the protocol, for instance, for asking questions and diagnoses, the protocol for investigations. And hopefully in the long run it will give the clinicians a very good comprehensive overview of what the patient's outcomes, etc. are. We have currently set that up so that it has a live capture of data during the more formal meetings. We are almost completed setting the database up so that it has live capture of data in the clinics. The next aim is to set up a research platform that will assist the researchers to access that data with appropriate security. And the final step will be to set it up to assist clinical follow-up of patients. I'd also like us to think down the track about looking about things like record sharing, potentially with patients, and maybe interacting with other big programs in Victoria who do similar work to us, so that we can enrich clinical care and research. In terms of my particular projects, what I'm interested in is long-term outcomes of epilepsy, which means looking at how people with epilepsy go from diagnosis, how their epilepsy evolves, how treatment interacts, how treatment improves or doesn't improve things for people with epilepsy. And so probably the fundamental requirement for those sorts of studies is that we have good quality data. And we need it in quite a lot of people, and we need it long term, which is why the databases are really important, and they're a fundamental basis for that sort of research.